Transitioning from RN to NP is hard, but we want to help make it easier for you. Today, we'll cover some of the most common job interview questions nurse practitioners can expect when heading into a new job interview. As an NP student or recent grad preparing for your first role, it's essential to know the type of questions that come up in interviews. I'll walk you through some of the key questions and strategies to help you feel prepared and confident. So why is it important to be prepared for these specific type of questions? Interviewing as an NP is more than listing your skills and experience. It's also about showing your future employer that you are confident, capable, and ready to take on the responsibility that comes with the role. You want to show that you're skilled in your specialty, but that you're also compassionate, adaptable, and have effective communication skills. Most questions in an NP interview can be grouped into three main categories: clinical skills, patient interactions, and collaboration with other team members. The first category, clinical skills, helps employers understand your medical knowledge and your ability to handle complex cases. You might get questions like, can you walk us through a challenging case you handled and explain your decision-making process? For questions like this, it's helpful to outline specific scenarios and walk through each step you took. Emphasize your ability to think critically and prioritize patient safety. Make sure to add any innovative solutions you may have come up with. Next up, we'll talk about patient interaction questions. Employers want to know that you are clinically skilled, but also capable of forming good patient relationships. They may ask, how do you approach patients who may be difficult or resistant to treatment? Your response should highlight your empathy and communication skills. Employers are looking for candidates who can build trusting patient relationships, communicate complex medical information simply, and help patients feel involved in their care. Now, NPs often work in collaboration with physicians, nurses, and other healthcare professionals. You might be asked, describe a time when you worked with a difficult team member and how you handled it. For this type of question, employers want to know that you are a team player who can professionally manage conflict. It's helpful to focus on how you stayed calm, addressed any issues directly, and worked toward a solution that kept patient care as a top priority. You may also get behavioral or situational questions. These are questions that ask you about past work experiences and how you handled them. They usually start with questions like, describe a challenging decision you had to make on the job. A great way to handle these questions is by using the STAR method: situation, task, action, result. Situation, task, action, result. This is a simple framework that helps you structure your answers, making sure you highlight both the challenge and how you effectively handled it. Another question that's pretty common is related to long-term goals. For instance, where do you see yourself in 5 years as a nurse practitioner? Employers use this question to find candidates who are committed to growth and see a future in the role. This is your chance to show your passion for continuous learning, improving patient care, and possibly specializing further within your field. Preparing for your NP interview doesn't have to be stressful. Just take time to think about your answers, structure them well, and remember that employers are looking for both skill and personality. And if you're still on your journey to becoming a fully licensed NP, NPHub is here to help you secure the clinical placement that gives you the hands-on experience you need to shine in your interviews. Good luck with those interviews, and we'll see you in the next video.